Hello, this is Rashi Sahai and you're watching Medicircle. Today on our colon and rectal health awareness series, we have Dr. Chintamani Godbole with us. Dr. Chintamani Godbole is a renowned gastrointestinal and colorectal surgeon in Mumbai and is currently practicing in Just Lok Hospital. For the past 8 years, he has worked in this field. Welcome to Medicircle, Dr. Chintamani Godbole.
Thank you for inviting me.
So, passing stool after having a meal is usually a result which tells us that our digestive system is functioning normally. But bleeding in stool always makes an individual worried. It can be a sign of a severe health condition that might need treatment. So, let us understand from Dr. Chintamani about this. So, doctor, can you please tell us what does bleeding in stool indicates?
So, bleeding in stool necessarily means that there is very likely a problem in your intestine. Bleeding in stool cannot ever be considered normal. Now, the bleeding in stool we like to classify as visible bleeding, that the patient can complain of themselves, or the patient can see himself or herself with her eyes, or the bleeding can be occult, which means that the bleeding is happening in small quantities in the stools, which is not visible to the patient. So these are very different entities. Whenever there is visible bleeding in the stool, the patient typically comes to us with the history that there is blood. Whereas whenever patients have occult blood loss in the stool, the patient typically presents with anemia. The typical patient that we get in this scenario is a patient who is diagnosed to have iron deficiency anemia and has been treated by iron preparations, both injectable and oral. Despite that, and the patient does not have any improvement in hemoglobin. In that case, it's very important for us to check the stool for any occult blood.
So, can you tell us about some causes of bleeding in stool?
Yes. So the causes of bleeding in stool in adults, there is a list of causes. This includes minor conditions and as well as some major health problems. Okay. So to start with, common causes of visible bleeding in stools, most common causes piles or hemorrhoids. Now, hemorrhoids or piles are essentially, it's a loose lining of the anal canal which is engorged with veins, and this lining sort of prolapses out of the anal passage, and that typically causes bleeding. It is one of the most common cause of rectal bleeding that we see in clinical practice. The other common cause is an anal fissure. Anal fissure is essentially a cut or a tear in the lining of the anal canal that's typically associated with passage of hard stools or constipation. These two are the most common causes of rectal bleeding. However, it's important to note that there are a number of diseases of the colon which can cause such bleeding. Some of them include rectal ulcers, which can happen in patients, especially who have prolonged constipation. The other causes of rectal bleeding include diverticular disease, which is basically a disease of the colon where you get small pockets of the colon outbulging from the wall. And then you have serious diseases of the colon, such as colonic polyps or colon or rectal cancer. Then you also have a number of diseases included under the title called inflammatory bowel disease, which includes diseases like ulcerative colitis or Crohn's disease, which cause inflammation in the lining of the colon and can present with rectal bleeding.
So, doctor, what is bowel cancer?
So, bowel cancer is basically a cancer that arises from the lining of the colon and the rectum. The colon and the rectum has a specific lining which is designed by nature to absorb water and salt from the stool and make the stool more solid. So, bowel cancer classically begins as a bowel polyp, as you can see in the slide. A bowel polyp is nothing but a small area of proliferation of the lining of the bowel. With time, slowly, this polyp can enlarge and then change into a cancer. It's important to note that the progression of a polyp into a cancer is a very slow progression, and it can take years for a polyp to actually transform into a cancer. This is very important because if a patient does have symptoms suggestive of bowel polyps and the patient has them diagnosed and treated in time, we can pretty much prevent the formation of bowel cancer in this patient.
So, what are the symptoms of bowel cancer?
The important symptoms of bowel cancer to start with is bleeding in stools, as we have seen. Now, this bleeding can both be visible and occult, as we discussed before. If the bowel cancer is very close to the anal passage, often patients will present with bright red bleeding in the stools. And a lot of times, patients may be diagnosed erroneously by even doctors to have piles or ulcers and being treated with all sorts of medication. So, any visible bleeding in the stools, it's very important to get yourself tested by the specialist. That is one symptom. The other symptom, which is of extreme importance, is something called change in bowel habits. Now, all of us have developed a habit or a pattern in which we open our bowels. For example, some people open their bowels, go to the toilet once or twice a day. Some people may be going thrice a day. Some people may be going alternate days. And everyone has their own lifestyle and pattern of bowel habits which they have developed over the years. If there is a change in that pattern and that change is sustained for a period of few weeks, then it is a very significant symptom. For example, if a patient who was never constipated in his life now suddenly starts to develop constipation and has to take laxatives, then it's something that's abnormal. For example, if a patient who has absolutely normal bowel habits all his life suddenly now starts having loose stools, which goes on to have which goes on for at least more than 2 to 3 weeks, then that is a significant symptom. So change in bowel habits is as important a symptom as rectal bleeding when it comes to bowel cancer. Then you can have other symptoms of bowel cancer, which when advanced will include a lump in abdomen or abdominal pain. This typically happens when the bowel cancer significantly enlarges and causes little narrowing of the bowel tube. Then, as we discussed before, a lot of these bowel cancer patients come with anemia because they have been losing blood, which is not visible to their eyes, and they typically come with iron deficiency anemia and have been treated. So that's another important symptom. And last but not the least, patients with bowel cancer may also complain of unexplained fatigue and unexplained weight loss.
Okay. So, how can one investigate whether it is a bowel cancer or any other health issue?
So first of all, as we discussed, any bleeding in the stools or any change in bowel habits, these two symptoms which we should not be taking lightly. So if anyone has these symptoms, it's very important for that person to seek medical help, get yourself evaluated. So typically when we see such a patient in the clinic, we will take a full detailed history. We'll do an examination of both the patient's abdomen for other signs of anemia overall, and also do a rectal examination in the clinic. And at the end of the history and examination, if necessary, we will recommend certain investigation. So it's important for the patient to get himself checked out. And in any case, when we are worried that the cause of bleeding in stools is not something like piles or fissure, which can be diagnosed and treated in the clinic, we always order a test called a colonoscopy. Now, a colonoscopy is essentially a form of endoscopy where there is a camera or a long tube which goes through the anal passage and evaluates the entire colon of the patient. It's an excellent test to look at the lining of the large intestine, and it pretty much rules out or diagnoses any serious problems of the intestine.
So, are there any other ways to prevent bleeding in stool? And if yes, then can you please tell us about those ways?
So, in terms of prevention of bleeding, so a lot of these problems cannot be prevented as such, but often if a patient has very irregular bowel habits or unhealthy diet, especially if the diet is low in fresh fruit or fibers or vegetables, then the patients tend to get constipated and the bowel habits may go a little erratic. In that case, these patients often present more with bleeding, especially because of piles. Also, in a hot and humid sort of weather such as us, it's very important to have a good water intake, because even if you are having a good dietary fiber intake, if you do not have a good water intake, that itself can lead to constipation and can present with bleeding because of piles or fissures.
Okay, doctor. So on Medicircle, our main focus have always been to provide the audience with large amount of information in less time. And so today we will be conducting a small question answer session in which you could either answer in yes or no, or a 1 or 2 line answer will also do.
Sure.
So my first question is, doctor, that can a small amount of blood in stool be normal?
No. Any amount of blood in the stool is not normal, and you should always get yourself checked out.
Whenever a person sees blood in stool, so how can he know that it's an emergency?
So most cases, it's not an emergency unless the patient has a profuse amount of blood which is coming out of the stool, and that is associated with lightheadedness or dizziness. That suggests that the patient has lost a lot of blood. So most of these cases are not emergency. Having said that, if a patient sees or anyone sees blood in the stools, it's always something that he or she should not ignore and consult a doctor immediately.
So, which specialist should an individual consult if he or she sees a blood in stool?
This initial part of diagnosis and management can even be done by a general practitioner, where the general practitioner can take history, examination, and diagnose simple conditions like piles or fissure. It's, however, important to note that if the bleeding or the symptoms carry on beyond a few weeks and they are not relieved with all the simple treatment that is being given by the primary care practitioner, it's very important for the patient to see a specialist like a gastrointestinal or a colorectal surgeon or a gastroenterologist.
Okay, doctor. Thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Thank you for inviting.